Welcome to Connect to Develop, where we provide insight from healthcare leaders on the hottest topic and trends.
Hello, listeners, and thank you for joining Erika and I for today's topic, which is the first of a two-part series on healthcare, where we've been and where we're going. I'm your co-host, Marney Reid. All right, Erika, we're just going to dig into it. So, major shifts have happened in the last 20 years. Healthcare has been simultaneously an incredible and a crazy but fun, crazy place to be. Can we talk about the digital revolution and specifically electronic medical records and health record systems?
Yeah, that's a big one. If I think back to when I first stepped foot into one of my first roles as a medical secretary for an ENT doctor, and everything was on paper. Everything that we did was everything from check-in to just clinic, post-op, everything was paper driven. And we were in the process of changing into an EHR kind of at the tenor that I was during the tenor I was there. And it was a complete disruption at the time. Everyone on the staff struggled, including, the surgeon that I worked with. And it to a point where he felt like he just wanted to stick to paper. He was a little bit like, I'm not doing this. And of course, eventually we all have to kind of get in line. And the EHR eventually ended up adding a ton of value. But that whole transitional piece, it was something that I know didn't just rock the world that I lived in at that time, but it completely rocked everyone's kind of operational day in and across every healthcare system office
So
at that
while I have a huge affinity and empathy for what was going on in the medical office from the staff and the provider side, that anxiety and that stress and that, added what's going on, had to have affected the patients in the office.
Yes, I would say yes and no. I think there's two layers to that. Yes, in the moment. I think anytime that there is some sort of back end major change going on, by default, the patient is going to feel that because we're out of flow, right? We're not in our day in, we're not comfortable. But at the end of the day, if you kind of think about the workflow of a physician, they're going from paper documentation, spending less time doing that, and all of that is moving into more digital dictation. So they're able to spend more time with the patient as opposed to spending all of that time doing the administrative tasks that were associated. So, I would love to believe that the patient in hindsight would feel less of the byproduct of some of the disruption and felt more, they had more time with their doctor.
The good news is probably during this switch is when all of the baby boomers were getting iPhones or, phones where you're trying to email and text. And so the doctor's probably walking in a little stressed from all of that stuff. And they walk in on a patient who's trying to figure out how to text their kid back with an emoji. So there had to be a win on both sides. But let's talk about telemedicine and remote care. Huge fan, right? I'm that typical happiest dream for a sports medicine, physical therapist doctor. I'm in my, mid 40s. I do work out, but I picked up pickleball immediately out the gates, two injuries, a lot of PT, a lot of icing that followed. And I truly appreciate the fact that I can be sitting here in my sweats, doing a consult or that kind of stuff. So what are your thoughts on telemedicine, remote care? And, that was that next step, right? We've digitized things, we can dictate notes. From your vantage point, how do you feel like that affected providers, right? As a patient.
Yeah, I'm with you. As a patient, I'm a fan. It's all about access and convenience. The level of being able to just, if I've got a sick kid, it's not like it disrupts my entire day. I'm able to access care in a convenient way. And I think for physicians, it would be the same. They're able to optimize their schedule by being able to have a portion of their schedule kind of dedicated to that telemedicine. You're almost increasing your ability to have touch points with patients. Of course, I'm not a clinician, but I would imagine, and some of the feedback around that has been that it doesn't. It increase their touch points with the clinicians in a more convenient way to provide care.
We also talk about, a lot of remote areas that can't access because either people can't afford, to your point, to take the entire day and drive to their doctor's office, or maybe they just can't even get there or whatnot. So I would hope that one of the things that telemedicine is enabling is more health equity and the ability for more people to get that great care that they may or may not be able to drive to.
You bring such a good point, Marnie, because think about like that specialized medicine or just having a particular specialist appointment that you need that's not within your within 5 mile radius. You have to go to like a different state or area. So that's actually a really, really good advantage of the telemedicine remote movement.
Another thing I was thinking of, because we're in a world where a lot of reimbursement is tied to patient satisfaction. And let's be honest, there's patients like you and I out there who are in healthcare who understand the pains that offices and physicians are going through. And so we understand why, when we've been sitting there in a cold office, they walk in, they're late, the patient's not understanding of it, et cetera. I would think that, hopefully telemedicine has increased patient satisfaction because they can no longer complain about the dour face that may or may not have greeted them when they checked in. They can no longer complain about the music and the taupe walls and the lack of beautiful artwork. And instead, you're just multitasking around the house or hanging out on your couch. So you maybe hopefully don't mind that your provider is a little bit late because you haven't disrupted your whole day to do it, right?
Yeah, yeah. I mean, you're right. I think of my doctor, and that's the reason why I'm pausing. Is it's a half an hour to get there. So if I have to drive the 30 minutes and then I have to wait 30 minutes for the care, then I have to drive back, I've lost nearly probably 2.5 hours just in the drive, the appointment, and then actually being seen, right? So if I'm home and I'm sitting there, and to your point, I'm still functioning, I'm still continuing to do what I need to do, whether it be work or whether it be handling, at home items, there isn't that disruption. So you're right. The whole survey, if they send me a survey, I'm probably going to give some positive feedback simply because I didn't feel any disruption.
So I'm going to play devil's advocate to my own positivity and say, okay, this personalized medicine aspect, right? Are we, with where we're going so rapidly with technology and all this remote access, which is good, would some people have a leg to stand on? Pardon the pun. Would some people have a leg to stand on to say that how can we truly have personalized medicine when you may go through much of your treatment, not surgical, obviously, but much of your treatment without even sitting face to face with your doctor? And for those people that still believe, you need those in-person touch points, is personalized medicine going to die out because of this remote care access? Or is it going to be enhanced because there's so many other options without taking up our entire lives with just going to that appointment?
Yeah, I would say it's probably going to enhance over time. I think with all of the AI, focus on kind of really personalized nutrition and medicines, it's the advantage, Marnie, is that it's truly medicine that is tailored to your specific needs. And so the advantage is that you're really being met where you are with your clinical needs. I completely understand that with the technology and AI, like there's something that's lost in the midst of that. And so I think that's going to come down to personal preference. You have some people that's fine and others that's a problem. I would be really, really interested to hear, what clinicians have to say on that topic, right? But from the patient perspective, I think it could go either way.
So when we factor in AI to this, is that something where it gets installed into our phone? What if you've got someone on there that's just freaking out and they're on WebMD just Googling everything, and suddenly they're just getting all of these pharmaceutical ads or all these ads for all these, horrible diseases that they probably don't have, but because they've been Google searching it, AI now thinks maybe they've got it. Now maybe we need to shovel a bunch of misinformation at them, which they then take to their provider. How do we combat AI, to make sure it's truly targeting what's going wrong versus what the patient may be wondering and researching?
Yeah, I mean, AI at the end of the day, it's a tool, right? It's a education that as a consumer, you start going, you go online, you get the information that you need, but I'm guilty, Barney, where it's like I go to Doctor Google or Doctor AI, and then you start kind of panicking with the things that you think you might. But ultimately, as a consumer of healthcare, we have to understand that there's still a professional at the end of the day that is able to take that information, kind of your full presentation, and be able to kind of give you what you need in terms of whether it's a diagnosis, treatment, whatever that is. I think we do it to ourselves. I do think that there's too much information and our mind wanders down a complete rabbit hole of a path. We need to reel it in and know that that's great information. It's a tool for us to leverage to be able to ask really good questions to bring back to our providers. But I don't know. I think the onus is on us as consumers to not let ourselves go down that path that can become very, very dangerous very quickly if we let our imaginations run wild.
One of the other trends that we've really seen is this change from fee for service into what we're calling a value based care, which at the end of the day, no one truly has a handle on it. But let's talk about the actual pathology that drove us into needing to find the solution, right? Healthcare crisis. I mean, as we've seen, if you look at the bell curve of all of the wealthiest nations in the world and the clinical outcomes that is produced by healthcare versus the cost, I mean, good job, America. We're winning, but we're the highest cost without seeing outcomes rise at the same pace of the cost of care. So, you've worked for some of the largest healthcare companies, you've worked in individual provider offices. Erika, what are the drivers of this healthcare crisis that we find ourselves in?
Oh, such a loaded question. If I think about the drivers, Marnie, we move really, really fast. The upside is that we're super innovative in our healthcare technology, in our application of care, all of those components, but we move so fast. And if I can kind of think back to just some of the hats I've worn over the course of my career in kind of the quality improvement space, is we have these regulatory measures that are coming out. We have just all of the different systematic systems that need to be in place. And we don't necessarily have the infrastructure, the support, or the budget to execute and be compliant. So there's just a host of concerns and issues that come up just with trying to meet a deadline around regulatory measures, right? The intent is that we're going to be able to provide outcomes and improve clinical care for patients, but there's a systematic approach that goes along with that. And I think my opinion is that there hasn't been a lot of investment or research or a lot of time spent on making sure that infrastructure is supported.
I feel like that's also one of the biggest issues with going from fee for service and then trying to rip out. And don't get me wrong, as someone who found herself in the ER I was not yet 30, with what at first maybe we were wondering was an appendicitis, but I'm a female, so there's other things down in that way area. I was in the ER for 13 hours and they ran every diagnostic test on me and they still weren't releasing me. And at one point, I had this thought, are they keeping me here because at a certain hour, they can bill for an overnight stay, and that just even increasingly charges my insurance? And as the patient, I'd already been cleared by 5 different departments and I was ready to go home. So I understand both sides of the fee for service, right? The hard thing is, to the point that you just made, introducing all of these concepts of you need to bundle, you need to do this, you need to do that. It's like they shoved down, they had people who had never truly participated, or if they had, it had been years since they truly participated in the actual care delivery for patients, sit in a room, decide what was wrong, who was to blame, how we should fix it. And then, to your point, almost no support, not the budget, not realizing the huge amount of care teams and added cost and added technology required to deliver this. So where do we go from here on shifting from fee for service into value-based care, when value-based care, yes, it's still creating value and stuff, but you're actually penalizing the people that have created the value and extracted the waste.
I don't know that there's an easy answer to that because we're in it. We're continuously in it. We've been in it for years looking for the right solutions. And so, I would love to say that there is a clear path forward, but I don't know, Marnie. I don't know. I know we're still looking for the ways that we can continue to improve care. I think as a healthcare industry, every professional that plays a part is focused on the fact that, look, a patient is on the other side of the delivery, right? And every year there's something new that's being introduced to get to that journey and meet those outcomes and make sure the patient has, at the end of the day, exactly what they need. I think we have a lot of room to grow and a lot more work to do.
Well, I love that we're just having these conversations. And what I love seeing is more and more surgeons getting involved in advocacy. And quite frankly, I think the people who put out there that we need to, create value-based care and we need to implement it, the intent was phenomenal. The intent was spot on. The goals of it were, my hope lies in more surgeons and, bless them on top of all of the other things that they're doing to take care of their patients and potentially have any kind of personal life where they see their families or have downtime.
I agree 100%. Advocacy, bring up just the point of advocacy in general. And that is really where I think the influence and the shift lies, is having people kind of stand in the gap, taking the charge and having a loud voice and being instruments of change.
Well, hopefully that was, our call to action, which is for patients out there, because it's one thing for the physicians and clinical providers to go out there advocating, but patients, you also can take charge of your healthcare, not just by, Googling on WebMD, what's wrong with, whatever's happening with you today, but really taking up and talking to your doctors and asking, what are the pains that you're fighting? How can we help? Who should we be writing letters to and getting involved? Because I put onus even more so on the patients that should be protecting their providers and enabling their providers to spend time on their care, by advocating for them. So Erika, this has been an awesome discussion. I'm excited for whenever we decide to do part 2 and hope the listeners got something out of it.
I know this is great. This has been great. There's a ton to unpack, and I think we could spend all day, Marney, talking about this.
We'll be the Patagonia of unpacking healthcare crisis. You can find more interviews on our YouTube channel at Marney Reid Presents.